Hi, good afternoon, everyone. Thanks for joining us today for our state and federal policy update. For those of you who don't know me, I'm Emily Beauregard. I'm the director of Kentucky Voices for Health and a member of the ThriveKY campaign. I know a lot of folks are still joining, but we'll just get started for the sake of time. We are recording this webinar, and a lot has happened in the past 2 months since I was last on one of these webinars. I hope everyone enjoyed celebrating our first and long overdue federal Juneteenth holiday last month. That was really exciting. And the 4th of July this past weekend, of course. I heard a friend explain to their children that Independence Day was actually a day to celebrate the continual work that we must do to make our nation the democracy that we strive for it to be. And I just thought that was such a great way to observe the holiday. So I hope more of us will think of it that way. Now, I know that most of you are probably familiar with our ThriveKY campaign by now. For those of you who are just joining us for the first time, we have a little bit of information about what we do. Kelly, can you advance the slide? Here we go. So our core purpose is to meet the basic needs of every Kentuckian through systemic change. And you can see our shared principles on this slide. We recognize that many of our fellow Kentuckians face historical and systemic barriers to meeting their basic needs. And for that reason, we strongly believe that the only way for all Kentuckians to thrive is through anti-racist and anti-poverty policies that will lead to a more equitable and just Commonwealth for everyone. And during these webinars, we always try to touch on what those policies should look like. So let's go to the next slide. These are our ThriveKY partners. And we can go to the next. And I wanted to give a quick thank you to our 2021 sponsors, Aetna, Humana, and United Way, or excuse me, United Healthcare. After a 3-day weekend, I'm just a little rusty. I'm sorry, y'all. But we really appreciate everyone's support for our work and partnership. So here's the agenda that we'll be covering this afternoon. We really want these webinars to be an opportunity for you to get the latest information on the state and federal policy landscape, hear updates on our safety net programs, share feedback with us, and ask questions. So during each section, be sure to put any questions or comments that you have in the chat, and we'll try to cover those as we go. If you have more questions than we can get to in these next 90 minutes, we'll be sure to follow up with written answers in our follow-up email. We do that the day after. So don't let the clock stop you from asking your questions. And before we begin, just some quick housekeeping. We are recording this webinar, so please be sure to mute your line. And we'll be sending out the recording and any materials that we talk about today, along with an evaluation in an email tomorrow, so you can watch for that. And if you are a certified community health worker or a licensed social worker and would like to receive CEUs for attending today's webinar, please contact Kelly. And Kelly can put her email in the chat. And with that, I'm going to turn it over to Dr. Sheila Schuster to get us started with a 2021 legislative update.
Thanks very much, Emily, and good afternoon to you all. I'm Sheila Schuster. I'm the Executive Director of Advocacy Action Network, which is the Kentucky Mental Health Coalition and the 874K Disabilities Coalition. Next slide, please, Kelly. So we introduced you last month to the interim session, which runs from June 1st to December 1st. And first, I want to remind you that the bills that we passed in the 2021 General Assembly session became law this past Tuesday, I think it was, June 29th. The only exception to that are any of the bills that had an emergency clause, which become law as soon as the governor signs them, or the 10 days elapse where he doesn't sign them but doesn't veto them. And there are still a couple of things that are tied up in the courts, but basically the work of the 2021 GA session is done, and now we're already in process for preparing for the 2022 General Assembly session, which will open the first week of January. So during the interim, the committees of the House and the Senate meet together, and they meet once a month. They talk about general topics. They also review 2021 bills that didn't pass and any pre-filed bills. We also have statutory committees, which some of you may follow, like the Administrative Regulation Review Committee or contracts reviews, capital projects, and they continued their monthly meetings. We have a new statutory committee. It's called the Commission on Race and Access to Opportunity. Was established by passing Senate Bill 10, which was a bill put forward by Senate Republican leader, Senator David Gibbons. And they had their first meeting in June and will continue to meet monthly. So we're going to show you in just a moment the schedule because it's hard to follow. The committees don't always meet on the same day of the month or at the same time. So they try to do that, but they change their schedule. Some of them will meet, for instance, when the state fair opens, they will meet out at the fair. And so you have to really stay tuned in with that interim committee schedule. And that's also available on the LRC Legislative Research Commission website. The big news, and we are really excited about this, is that they just announced that both the Capitol and the Capitol Annex are now open to the public. All you need to do is to appear at the front door of the Annex or the front door of the Capitol and check in with the guard there. You have to have a picture ID. I would suggest giving yourself a little extra time because I think people are anxious to get into the Annex and to participate in person in those meetings. So democracy returns to Frankfurt. And if we could go to the next slide, Kelly, please. So this is the calendar. This is what it looks like month by month. And you'll notice in italics, for instance, on the 19th, that's when one of these special task forces that we're going to talk about in a minute is going to meet. So that's the school funding task force. If you look down then on the 26th, there are two of the task forces that are meeting, the unemployment insurance reform and the home and community-based waivers. So you'll see that they vary greatly from week to week. SLC is the Southern Leadership Conference, and that's a legislative convention that many of our legislators attend. So they don't want to schedule meetings on those 3 days, and that's what SLC means. All of those meetings should be held in the Annex. They're also available virtually as they were during the pandemic as well. Next slide, please, Kelly. So I wanted to bring special attention to these special committees. And when you look for the information for them, when you go to the Legislative Research Commission website, which is www.legislature.ky.gov, if you go to committees and then scroll down to special committees, you'll see these 6 special committees or task forces. They are appointed by legislative leadership to meet during this interim session, and they are focused on a scope of topics, and they will be making recommendations for the 2022 session. So some of you may be very interested in those special Medicaid waivers. They're called the 1915C home and community-based waivers. They're the Hcb, the supports for community living, the SCL, the Michelle P, the ABI waivers for short-term and long-term. And those are very important additional services that are given to people with disabilities that allow them to remain in the community rather than to be put in an institution. So there's been lots of talk. There was work begun in the Bevin administration to redesign those waivers, and then it was stopped when the new governor was elected. And so this task force is particularly concerned with those redesigns. I'm very happy as a psychologist. I've advocated for a long time for us to focus on Kentuckians who have severe mental illnesses. These are illnesses like schizophrenia or schizoaffective disorder or bipolar disorder. And we think that they need additional services besides those that are just offered by Medicaid. They need additional supported housing, they need supported employment, and some other changes in funding and in the law. So that task force is meeting on Tuesdays at 3, usually the 3rd Tuesday of the month. Some of you, I'm sure, have either kids or grandkids in our public schools, or perhaps you're a teacher or a school administrator or a school employee. So you're going to be interested in the school funding. And those meetings are on Monday. They actually have set aside 6 hours to meet because they know that they're going to have so much data presented to them. There also is a special task force to look at possibly additional taxation on pari-mutuel wagering. You may remember that there was a bill passed in the last session that made it possible for the racetracks to continue with their games, so to speak, that look like slot machines, and they had to change the law to allow those. And there are many of us that feel like those that wagering, that type of wagering, should be taxed at a much higher level than it is. It is taxed at a much higher level in other states, and that revenue is revenue that we could certainly use here. There's been a lot of talk and a lot of concern about unemployment insurance, and so there's a task force that is looking at those issues. If you're having trouble with unemployment insurance, you may want to tune in to those meetings. And then the county clerks are having some difficulty both with funding and I guess some of their scope of practice in the legislation. So there's a task force that's looking at county clerks. And again, we have there the link. If you go to legislature.ky.gov, go to committee, and then go to special committee. The meeting materials, the agenda will be available there. And again, you can watch those remotely if you can't get to Frankfurt for those meetings. Last slide, please, Kelly. So just a reminder that you can be involved during the interim, and this is a great time to catch legislators before and after these meetings. They're not in Frankfurt every day because they're not in session, but they do, a lot of them are coming to Frankfurt to participate in these meetings, and it's a good way to catch them before or after. You also can check the legislative website for the meeting schedules to identify your own legislator. There's a map that you can enter your home address, and it will pop up with your House member and your senator, and you get some background on them. This is the link to go to either the KET televised meetings, or they're captured on the legislators live stream. It's a YouTube live stream, and those recordings should be archived. I'm not clear that the YouTube ones are being kept and distributed, but the KET ones certainly are. Many of you know the legislative message line, and it is in operation at regular switchboard operators. That's 1-800-372-7181. And those of you who need assistance for hearing difficulties can relay at 711. Your legislators' offices can be reached by dialing that 564-8100, and also their email. If you are just now introducing yourself to your senator or your representative, I would suggest in the subject line that you put, "I am your constituent." We think that legislators always want to know who their constituents are and want to listen and hear from their constituents. Be sure to include your home address and email, obviously, and phone number. Don't hesitate to contact legislators at home. I did not say at midnight or at 3 in the morning, but in regular business hours. Very often they have posted their home phone numbers and their work phone numbers, and that information can be found on the LRC website. You can also leave a message with the receptionist in their office and say you're a constituent, if you are, and that you really need to reach Representative so-and-so or Senator so-and-so. So that's my advice. This is a good time to get in training for activity during the regular session when it looks like we'll be able to be back in Frankfurt. But this is an important time, this interim session, and it's a great time for access to legislators and possibly the opportunity to make testimony or present your issue to the legislative joint committee or to one of the task forces. So I'll end at this point and turn it over to Kara, who will give us a bird's eye view of what's happening at the federal level. Thank you.
Thank you, Dr. Schuster. Yes, hi, I'm Kara Stewart with Kentucky Voices for Health, and I won the Thrive Kentucky webinar lottery this month and get to talk about the child tax credits, which are about as good a news as we get coming out of from anywhere, really. Kelly, let's move on into this is just sort of the big picture reference slide that you're just going to have in your reference materials if you want to see numbers. Here's the numbers. Big giant number, 17 billion, very hard to comprehend. It goes to all kinds of good stuff. But this is not what we've talked about this the last couple of months. So I think people are probably familiar, not sticking on this, just leaving it in here for reference. Some of the new information though, this is still what's actually been appropriated out of our legislature, and there's still a lot left to go. So there's still a lot more money to decide where it's going. So we know how Dr. Schuster just mentioned reaching out to your legislators. Reach out to them and say how you think some of this mountain of money that's coming from the federal government should be spent. Like they need to hear from you now, because they're starting to have conversations now about what to do. And there are people who are forming ideas, and here's what you got to remember. If you're not contacting them, someone is. There is someone who is contacting them about how to spend this money. Trust me, every day they're hearing from somebody. So, if you want them, think about that. Imagine who those people might be, and then think, maybe that should include me. And you reach out to. All right, next one. So before we get to child tax credits, let's talk about the basic human needs relief checks that have gone out. I hope most people on this webinar have received theirs. If not, you still can. I know it says now the deadline to file is May 17th, but there is still an opportunity to check the status of your relief check. And if you did not receive it, there's still an opportunity to have that applied onto your taxes moving forward. So the deadline to make sure that you are getting it timely, it has passed, but the deadline to get that money has not, in total. So you've not missed the boat. Spread the word. That link is live. You can also do it if you just go to irs.gov. There's a link that's pretty obvious at the top. Make sure that your friends and family, if anybody didn't get it, find out why. So this is the big news this month. We've talked about it, we've led up to it, but now we have real details about the child tax credit. So the American Rescue Plan Act, ARPA, has put in it something that most of the worlds with economies similar to ours, pretty much all but one other country already has and has had for a long time, which is the child tax credit, which is money that we send to support children, to keep children out of poverty. So this is the first time we've really tried this in a significant way in our country. And it is about big a deal as it gets, because it will reduce for this year child poverty by almost half. Almost half. I mean, that's a wild number if you ask me. And so 1.1 million Kentucky children are eligible for this expanded child tax credit, which I don't know if you all did that quick math, but we have 1.1 million children in Kentucky. So there's a very, very small percent of children who are not going to be directly affected by this tax credit. So nearly all Kentucky children are going to get something sent to parents on their behalf, to adults on their behalf. And that number, it's something that I don't want people to be worried about. I know that there's some misinformation out there about you're going to have to pay this back. That's if you're in the 1% or so of people who make a lot more money this year than you made last year, and so much so that you jump up over that $150,000 for a two-parent household. So that's going to be nearly no one in Kentucky who's going to have a big change of income to go over that line. But even then, you're not going to have to pay it back. You just don't get the second half when you file your taxes. So the way it's set up is so that you get half up front to help your cash flow now. Because everybody, all the parents, especially on here, know about the earned income tax credit and tax credits in the past. But those are only once a year when you file your taxes, which is great, but not nearly as helpful as money every month. And this takes that tax credit and makes it into a monthly check that will be, if you get the full credit, $250 for children 6 to 17 under their 18th birthday, and $300 for little kids under 6. And that's going to be every month, starting July 15th. We've got the calendar through the end of the year. Then when you file your taxes, you get the other half, all of it, if you're eligible. And if not, you get less than the total amount. So it should really protect people from having to pay back anything. So I would encourage people to take the full cash each month as you go to benefit your cash flow. I think the risk is very low. that would be in any way risky for anyone. So just to sort of spread that word. All right, Kelly, let's move on to, this is sort of the same stuff I just said, but it's going to help almost everybody. And if you filed taxes in 2019 or 2020, then you're good. So if you've done that, then you're automatically essentially signed up. So you will get this child tax credit the same way that you got your stimulus, your relief money. So it should be pretty simple for most people. Most people are already signed up and ready to go. If not, then you're gonna have to go to the IRS website and put some info in. But that is a very small percent of Kentuckians. We can go ahead and go to that though, Kelly. So here's that portal. If you want to go to this portal, I know you can't see this unless you got like super eagle vision here. I mean, I know what it says because I put it in here, but it's just to show kind of basically irs.gov. Make sure they've added this little American flag that says this is a American government website. Make sure that's there because there are a lot of scammy, spammy knockoffs. And if you go, I found 4 links in about 4 seconds on Facebook to scam tax credit sites that had IRS in their website. So just make sure that it is .gov if you're putting any information in, and make sure that it has got this little American flag at the top. And then you'll see these 2 big blue boxes that you can't really read what they say, but there you can see that they're click boxes. It says manage payments. And then this is information for non-filers for how to submit your information. There is going to be a 3rd one of these boxes coming for children who move back and forth between parents. And children where the parents are not agreeing as to who should be eligible for this tax credit. So that's not yet figured out. So we're working on it. The IRS has promised to have that portal open this summer. They recently, from last month to this month, they changed the language on the portal from summer to late summer. And I'm not sure exactly what the IRS determines as late summer. But I'm hoping that still means, by next month, right? Like before Labor Day. But they have caveated that they still haven't figured that out. My guess is because it's really messy. If anyone on here has ever been a part of those sorts of arrangements, it's tricky. So it's not that they're not trying, it's figuring out how to make people submit it. It's going to be similar to the way you do your taxes, where you submit, and if the other parent does it, you think they're in the wrong, you have to file to rectify that, balance it out with IRS. All right, Kelly, let's go to the next one. So here's probably what anybody actually cares about, which is when you get your deposits. Look at the calendar. We're a week out. In 1 week, Kentucky families, nearly all Kentucky families with children are going to get a deposit that's going to appear. And it is going to be, for almost all of them, that full $250 per child. So if you've got 2 12-year-olds, you're going to get $500. If you've got 2 10-year-olds and a 5-year-old, then you're going to get $800, $500 plus $300. So it's per child, which is really going to have a big impact for Kentucky families. There's no other way to look at it. I know I've said that 10 times, but that's kind of what I hope everybody takes away from this. Children need more money in Kentucky. Parents need more money, and this is when we're going to do it. But I'm also getting to my ask. This is only for this year, which is why the custody deal is such a big deal, because a lot of families rotate years, and you can't rotate years here because it's just for 1 year. So we need this to become permanent. It will become permanent if the American Families Plan is passed as it is written currently. This is included as a permanent anti-poverty measure and as a support for children, American children, in the American Families Plan. That plan is currently in limbo. I'm sure you're shocked to hear that Congress has something that's in limbo, but we have got 2 bills out of President Biden's 3-part bill proposal that we're looking at. So, but before we leave this slide, I just want to make sure you'll see, I brought you the IRS language directive late summer. That's as specific as I can get for the updates. However, we're already in the point where you can check to see if you're eligible. You can check to see when your payments are going to hit and how you're going to get them. So you can already go log in and see that, and you can update your address.
Get over here.
What now? Somebody have a question?
I think we might just need people to be sure to mute their lines.
Okay. If you have a question, feel free to ask. If I know the answer, I'll do it. Also feel free to put it in the chat, no worries. So basically it's there's just one. I was going to just say you get the deposit on the 15th of every month, but August is a spoiler month and it comes early on the 13th. So that's why I put the individual months. The IRS could not stick with the 15th. I don't know why, but just so you know, this is the day, but some people will be getting paper checks and some people will be getting direct deposits the same way the relief checks happen. So the next slide. Oh, no, this is just, we're talking about the plans that we need to call DC about. So next slide after this. Next slide, there they are. The American Jobs Plan, American Family Plan. Here's, you're right there. The one with the typo is the one I want. The next one. That one. Oh, maybe I just flashed fast. It doesn't really have a typo. So there's these three big bills, the Build Back Better bills. The first one is law, American Rescue Plan. That's what we're calling ARPA. That's what you've heard a lot about. That's where this child tax credit came from. That's where your relief checks came from. That's where lots of money that's coming into Kentucky that you need to call your state senators and state representatives to talk about is coming from. That is the law. That's where the covering which you're going to hear more about later, and all kinds of details regarding housing and lots of benefits for healthcare and healthcare enrollment. Tons of good came from the American Rescue Plan Act, which was signed into law in March. Right after that, we were introduced to the American Jobs Plan and the American Families Plan, which are very intertwined and interlinked. I'm sure you're shocked to hear that because, but families and jobs go together, right? You can't, families don't necessarily stand apart from the economy. We're all a part of the same machinery here. And there's back and forth happening. The only thing that we know for sure is it's not going to pass this month, or it's not going to pass right now. It hasn't passed. There's negotiations going on. There have been some radical changes and approaches to look at it, whether or not there's going to be a bipartisan bill. There's been a lot of efforts towards there being a bipartisan bill and a lot of meetings. And hopefully we're going to come out with something that makes these big pieces permanent. So that's what, if you're going to make your phone calls this week, make a phone call and say, make that child tax credit permanent. That's an important part for me because it is a big part for all of us to support our children. All right, and then I may be finished, we'll see. Oh, no, all the details, I forgot. These are the details. Didn't want to leave you hanging. Also don't want to bore you to death, but there's so many good, important things. These are major investments. So it's a once in a generation investment in our nation's future. There's no other way to say it. The goal is to create literally millions of good paying, better than living wage jobs and rebuild our country's physical infrastructure and workforce and create places to spark innovation and create manufacturing and all kinds of sort of meaningful livelihood in America. So the Families Plan is a similar level of a once in a generation investment in our children and families. So it is to help families cover basic expenses, so we don't have people that are struggling with those sort of basic human needs of food and shelter and clothing, and lots of those expenses that many families struggle with now. Permanently lowering the cost of health insurance by lowering the health insurance premiums the same way they have been in ARPA, continuing all of the elements of the American Rescue Plan's historic reductions in child poverty, like the child tax credit. And then the most money that any of us have seen investing in both our economy and our families. So it adds 4 years of free education for Americans, provides those direct supports, and extends the tax cuts for families with children and American workers. So those are some of the big top of the bucket pieces. And there's also universal preschool for all 3 and 4 year olds included in there, free community college, and some other post-secondary investments. Lots of details. And so here's some of that. And then there's some other links to get to the rest of it. And now I will, in fact, turn it over to Anna from the Kentucky Center for Economic Policy, KY Policy.
Thank you, Kara. I'm Anna Baumann, Deputy Director for the Kentucky Center for Economic Policy, filling in for Dustin Pugel, who normally does our part of these webinars. I'm glad to be with you all today. And to follow on Kara's coattails, she said if it has to do with families and it has to do with jobs and vice versa. So Kelly, next slide. I'm going to talk about jobs in the economic context. So understanding what's happening with with the economy and the labor market is really critical to understanding the importance of the safety net. So a big example that I think everybody gets is that we lost a lot of jobs when COVID struck in the beginning of the pandemic, and we're still not back to where we were. So with the labor market struggling like that, with losing so much of our employment, all the forms of assistance that we've seen Congress pass to come through and help families get by have been really critical. Because they do just that. They help us make ends meet, pay the rent, keep food in the cupboards, but also because they boost demand. So all that aid, it goes into people's pockets, and then they have money to go out and spend, and that helps our economy from falling even further. We'll talk more about demand in a little bit. So this graph here showing the Kentucky jobs numbers shows that we've recovered a good bit. We're not back to where we were. This is through May. The June jobs numbers on the national level were really good. We added 850,000 jobs, and we can expect Kentucky's numbers to look similar, but we're still in a hole that we're climbing out of. And so all of these programs that we're talking about, the American Rescue Plan Act with the child tax credit payments that are going to start coming out that people will be spending, and then more legislation that we need to pass to continue supporting families as they get by until they can get back on their feet. And that continue to bolster demand in our economy are really important. Next slide, Kelly. So to that point of all the federal relief being really important for our economy, what this slide looks at is what consumer demand has looked like over the last year. And so you can see that big trough in March and April of last year, but then the CARES Act was passed in March of 20. And that helped with demand. And then we saw more relief in the Appropriations Act in December, and that helped. And then the American Rescue Plan Act was passed in March of this year. And so, the programs that those resources have flowed through are things like the boosted unemployment benefits, the boosted SNAP benefits, the stimulus payments, and then this, starting this coming month, the child tax credit. Those resources are really helping our economy. They're helping us, they're helping our economy. One thing you might have heard about is that some people are concerned about inflation. So all of the pent-up demand from higher income people who had savings during the pandemic, they weren't out spending at restaurants and on vacations, et cetera. They saved a lot of money. Now they want to spend it. And just the stimulus coming from these federal resources are, boosting demand right now. And so while there is some short-lived inflation, the Congressional Budget Office anticipates that it will only reach 2.8% this year, which is not bad. And they anticipate that it will return to its target rate of 2% or below in the coming years. So you may hear people worrying about that. It's not something that we need to worry about. Next slide, please. And this one, I'm going to talk about another thing you may have heard people worrying about. So you may have heard that the relief money is hurting us, that because people are getting support while they've lost their jobs, while it's unsafe for them to return to work, while they're having a hard time putting food on the table and keeping the rent paid, that because of all of this, they're not willing to work and earn money by being employed. So the research just doesn't bear this out. The research is clear that the boosted unemployment benefits, the stimulus monies are not keeping people at home, and they're not preventing people from being employed. In fact, some states have cut off their federal unemployment benefits early, the $300 a week that Kentuckians are still getting. And it's really smart that we're still getting these benefits because they're helping families, they're helping our economy. States that cut them off early are not seeing people return to jobs in better numbers. What's keeping people at home is that we're still in a pandemic. There are still health risks associated with people returning to work. Some people are suffering from long COVID. People are having a hard time finding childcare. And more generally, the truth of the matter is that it takes time to hire back half of the labor force. It takes time to reallocate that labor for people to get matched up with jobs that are a good fit for them. So it takes time. But what this slide shows is that it's happening. And in fact, it's happening very quickly in low wage sectors, which is where if there was an impact of all of these relief dollars leading people to stay at home rather than get jobs, you would see that impact in low wage sectors because that's where, you know, the benefits would potentially be more than what people could get paid at work. But in fact, what's happening is that some of the sectors where people are returning to work at the fastest pace are these low wage sectors like leisure and hospitality. In fact, the hospitality and leisure regained the largest number of jobs in May. Again, it just takes time to rehire half of the labor force. So this slide just goes through employment by industry and shows the gray dot, the jobs kind of at the trough, all the jobs that were lost in April of 2020 and where we are now, how many are still missing. So as you can see, a lot of those industries are very much recovered. Okay, last slide, please, Kelly. So back to the CBO, that's the Congressional Budget Office. They're a nonpartisan research office that works for Congress to understand how much different bills cost. They came out with a recent report that shows we're headed back to normal extremely fast for an economic recovery. So there's some stats about that on the right side of this slide. They anticipate that we will recover all lost jobs by mid-2022. They predict an uptick in hiring in the second half of this year. They expect good GDP growth, and they assess that the American Rescue Plan Act funding is a primary driver of this fast recovery. A counterpoint to this success story is one that many of us are personally familiar with. In the Great Recession, the congressional response to that economic recession was too little and it was ended too soon. And what that meant was that we had an extremely slow recovery. And we never actually returned to the employment levels that we had before the Great Recession because of that extremely small federal aid that ended too fast. What we're experiencing now is a success story. We're still in the middle of it. We're still on our way out. We're still recovering, but all signs point to it being an extremely fast recovery and that these aid plans are working for families and for our economy. So the main takeaway from my portion of this presentation is just that federal relief is working, it's doing its job, and we need to sustain it and build on it. So as Kara was sharing her ask with you, I'd just like to reinforce that. Let's look forward and not look back. We need to be looking forward at the American Jobs and Families Plan as the next key steps of a robust recovery that not only help us regain what we've lost in this crisis, but that give all Kentuckians more opportunity and a better shot at prosperity. So with that, I will pass it on to Tyler, and thank you all for having me here.
Hey y'all, thanks Anna. I am Tyler Offerman with the Kentucky Equal Justice Center, also pitch hitting for Dustin, who I am now realizing carries an extraordinary amount of information in these presentations. I'm gonna touch base on unemployment insurance. Anna already touched on some of this, so we can move to the next slide. So this slide is just showing us unemployment, folks on unemployment going back to effectively the beginning of the pandemic. You can see them broken up by color, quick, just helping you differentiate the three. So UI just stands for your standard state unemployment. PUA, that's Pandemic Unemployment Assistance. That was the program created by the CARES Act that specifically helped gig workers, substitute teachers, other folks who were not traditionally included in traditional unemployment. And then PEUC, the Pandemic Unemployment Emergency, Pandemic Emergency Unemployment Compensation. Sorry, then I get mixed up with the acronym soup sometimes. That's effectively just extending state unemployment, that's just if you've ran out of the number of weeks. Traditionally in unemployment, you get a certain number of weeks and then you are cut off. So those three, there is a fourth, which is the pandemic unemployment compensation. Folks might be familiar with it used to be $600, now it's $300. That's just the piggyback that goes on top of if you are in one of these three programs. So as y'all can see from here, unemployment numbers have been dropping precipitously as we have been moving, hopefully, fingers crossed, out of the pandemic. Just a couple things to note. Anna already did a much better job of me than justifying, why unemployment is necessary, but just a couple other things to keep in mind. So if you add up these numbers, but exclude folks that wouldn't normally be in unemployment, so pretty much everyone who's in PUA, or you kind of look at the normal amount of people that would be in state unemployment, right? Because every month of every year, there are some people who are in unemployment, who are getting laid off and rotating through jobs. So if you look at who is on unemployment that would not traditionally be, so then you're just looking at the traditional, quote, traditional employee claims, it's about 33,000. And Anna already pointed out that there are about 90,000 fewer jobs than before the pandemic. So there are this notion that there's this massive amount of people that are just, on the draw, getting unemployment, not going back to work is simply it's not panning out in the data. A couple other things. Right now we've got about 2 months until PUA and PEUC expire without further congressional action. And there's about 40,000 people right now that are in that situation. So without further congressional action, and if rates stay the same, that's about 40,000 Kentuckians that will suddenly be losing their benefits. And Anna already did an amazing job, again, of laying out why it's important to make sure that consumers get the funds they need to meet their basic needs, but also support the economy. 2/3 of the US economy is based on consumer spending. So if you suddenly decrease that, it's literally the worst possible thing you can do during an economic recovery. So making sure that people have money to take care of themselves and their families, but also run the main engine of our economy, pretty important. Go to the next slide. This is just another way to look at that data. And I really want to articulate a point here that the new unemployment programs that Congress created in response to the pandemic are job creators. So when you look at again, consumer spending, those folks go out, they spend that money in local economies, those go to local businesses, entrepreneurs, chains, and corporations. Those businesses would have to lay people off if consumers weren't spending money at their establishments. So I know the Economic Policy Institute did a study last year on the $600 benefit, and they estimated that if that had gone away, we would pretty much immediately lose 50,000 jobs. So, there's a lot of what I would consider misinformation or really just disingenuous information out there about unemployment. And I don't know how many different ways I can say it, but it is wrong and it is not based on the data. And, there's a couple facts here on the right. $500 million have come into Kentucky. Sorry, I lost my page there for a second. Yeah, so as you can see, since the $300, $500 million has come into Kentucky. Since last year, FPUC has brought in a total of $4 billion. That's a massive amount of money. And that ensures that our economy is going to keep functioning. And as that money is spent, the economy grows, local businesses can keep people on the payroll. Go to the next slide. This is a really interesting analysis recently that has been done by Indeed. Many of y'all may know Indeed, the job search engine. So they did a a survey where they reached out to all the people in their system, so they were looking for jobs, but they were not accepting jobs. And they asked why, why is it that you are obviously looking for jobs, but you are not, applying for and accepting the jobs that are being posted. And y'all can see on the left there that bar graph shows that the two main reasons is they're looking for better job opportunities. So the jobs that are being offered don't have good benefits, don't have good pay, or they are looking for an increase in vaccination rates. They are scared of the public health implications of going back to work because either the rates of vaccination are not high enough in their region or they're not high enough in that profession. And those are especially concerning for folks that live with immunocompromised folks. So, almost 60% picked one of those two things as, one of the main driving factors. Only 1 in 5 workers actually cited the unemployment benefits as being the main reason they were not going back to work. And multiple studies, lots of research have shown that the $300 simply is not a factor. Again, Anna pointed out, of all the states who said, we're going to cut off these benefits because we just got to force these people back to work, Kentucky is seeing much more robust job growth than a lot of those states. It's simply not playing out like that narrative, would assume you to believe. So, and again, we mentioned the independent contractors and small businesses. Well, there's a lot of really good news when you look at the 30,000 foot view of the economy. There are a lot of independent contractors and small businesses, I used to be one, who are still really struggling. I mean, a lot of things changed. People's habits, the way people spend, the way people, want to interact with the economy. People are trying to recalibrate how to make a living, how to run a business in this new and changed economic landscape. And it would be really terrible for them and might even force them to close their business if they did not have the safety net to make sure that they could continue to get by. And then last point, again, when it comes to those low wage sectors, accommodation, food service, those only make up 6% of unemployment claims and only make up 8% of the Kentucky workforce. So yes, while some of them might be struggling, I would argue that maybe the fact that a lot of these industries have kept their wages and benefits so low for so long might be the reason why they're struggling to find workers, not the modest unemployment benefits. And then last point before I hand it off. So, when you look at PUA, the average amount is about $150 a week for PUA, $150, $170. When you add the $300 in PUC on top of that, you're looking at, if you were to actualize that out over a yearly income, that's about $17,000. $17,000 is effectively a poverty wage. So to say people are more interested in making a poverty wage than taking a reliable job with reliable benefits, it's just smoke and mirrors. So that I'll get off my soapbox now when it comes to unemployment. The last thing I'll say, there were a couple of questions in the chat just about, like, we all know the unemployment system has been really hard for clients to navigate. I'll put my triage list of how to help folks that you might be working with, whether family, friends, or clients, to how to access or get some answers from the unemployment office. It really sucks that it's as difficult as it is, and I really hope that our General Assembly will invest in our unemployment system to make sure this never happens again. Sheila Schuster, if you could put in a word with your friends in Frankfurt, really appreciate that. So with that, I'll hand it over to Jessica Klein.
Thanks, Tyler. Hi, I'm Jessica Klein with the Kentucky Center for Economic Policy, and I'll be talking about 2 food assistance programs, SNAP and PEBT. Next slide. So even before the pandemic, 1 in 7 Kentuckians were food insecure, meaning they didn't have access to consistent good quality food. And with increased job losses that Anna and Tyler talked about, we know that that number has been exacerbated by the pandemic. So I'm going to talk a little bit about the Supplemental Nutrition Assistance Program and the Pandemic Ebt program, which have had broad support for food assistance to kind of address that increased need. So SNAP responds quickly to changes in the economy and helps feed families and boost the economy. So you can see at the kind of the end of this very long graph that goes all the way back to 2006, those kind of spike at the end is the pandemic. And that's an increase of over 100,000 Kentuckians that have been supported by SNAP throughout the pandemic. And we are currently at over 603,000 Kentuckians that participate in that program. It's fully federally funded and provides 9 meals for every 1 meal provided by a food bank. So recent policy changes have made it easier to get these benefits that you might be eligible for. So if you've applied before and been denied, now is a good time to reapply. So the link to the application is at the bottom of the slide when you get it in your email. Next. There have been a lot of flexibilities within the SNAP program to address the pandemic. So I'm going to kind of review a few of those. But before I get to that, I want to talk a little bit about recertification. Recertification for SNAP was waived for 6 months, but that window kind of began again in April. So a lot of people may have lost their benefits since April if they have not recertified, which is what we've been hearing from Hcbs, the Department for Community-Based Services. Basically, to recertify, somebody would receive a notice in the mail with their recertification date. They can complete the required interview by phone. You don't have to be in person like you used to, so it's a little bit easier there. And documentation can be submitted by mail, fax, or online through Connect. There's been, a little bit of confusion about what counts towards SNAP and what doesn't in terms of stimulus payments, the new child care tax credits or UI payments. They may not disqualify you. So if you aren't sure and you're getting these new payments, it's worth checking into. So definitely call the Hcbs number to learn more about what may or may not count for your SNAP. And a few of those flexibilities I mentioned are continuing. So the emergency SNAP benefits, also known as the max allotment, which really provides everybody the maximum amount for their household size, has been approved yet again for July. So that's great. Everybody will continue to see that additional increase in July. We've also seen a 15% increase in SNAP benefits, and that will continue through September 2021. I'd also like to say that public charge has ended. That means that's right. I see Anna cheering. That means that families that are impacted with a family member who has a change in immigration status, that your SNAP will not count against you in a public charge case. So that rolling has ended, and that's a good thing for SNAP participants. There are also fewer requirements for low-income college students that might qualify for SNAP. So again, getting that word out there about the SNAP program and the new rules that might mean somebody is eligible when they weren't before. So a good time to reapply. Next slide. The other program I wanted to get into today is the Pandemic Ebt program, PEBT. We do have a few updates here. So we're looking for, we've received a plan approval for the Pandemic Ebt program for kids who are ages 1 to 6. So this is a new group of people who are eligible for PEBT who have not ever received it before. And though this plan's been approved, the timeline has not. So we're still waiting for a little bit of information before people actually see these benefits come on their cards or new cards are delivered. But basically eligible households are kids that are 1 to 6 that have participated in the SNAP program and who had a daycare closed during the pandemic. So that's October 2020 through now is the timeline that they're using for that program. So we'll see those benefits hopefully going out soon. The timeline will be updated and we'll be able to share that out with this group when we have that information. Summer Pandemic Ebt is the other piece I wanted to cover, which provides PEBT benefits to over 650,000 eligible students. Those are students that participate in the National School Lunch Program or free and reduced lunch during the school year, and they should see those benefits for the summer. The goal is that Each student will receive $375 to cover kind of the summer costs that come with buying food that they don't get any support for this summer. So hopefully the summer PBT program will be approved soon. We'll get that timeline and benefits will go out for those. One thing we do want to mention with this is that a lot of the benefits will be issued directly onto a PBT card if you have one. It will go out on that. They look like the card on this picture. There's also been a few new ones that are different colors, but it's a very similar look. And then for households on SNAP, these benefits will go automatically onto your SNAP EBT card. And then for those families that have never received a PBT card, you would get it in the mail. And it's a very plain looking envelope, so be sure to open your mail this summer. Next slide. Okay, and seeing before I get going on this slide, I do see a question in the chat that summer PBT has not been approved yet, correct? Generally, it's approved in the fact that all states can apply with a plan that has to be approved by the USDA. So we're just waiting on the USDA to approve Kentucky's plan for PBT this summer. So I'm going to talk a little bit about the reconsideration process. And this is if you received less grocery money than you think you're eligible for, you can contact the Department for Community-Based Services for reconsideration. And basically they'll reconsider the amount of days you were eligible for throughout the school year and be able to potentially provide you with additional benefits if you didn't get all of the benefits you're eligible for. So what you need to do this is you need your student's full name, their date of birth, and their student ID number, also called an SSID, which you can get from the school office. So you need that information and to call DCBS at the number on the slide. The reconsideration dates are basically if you're calling, and trying to have your case reconsidered. If it's reconsidered by this date, then your issuance will be done in the same month. Those timeline is very short, so it should be showing up on your card quickly after your reconsideration. And some important contacts here, if you've lost your card and need to have one replaced, you can call, it's the number of the card company, it's this 888 number on here, and have that card replaced and it'll be mailed to your home. And then for any other questions you have for PBT, you can call the number. They also have a pbt.info email address that you can send questions to. And there's an FAQ on their website, but that FAQ has not been updated for childcare or for summer PBT. So that information will be coming out soon. I'm seeing a few more questions in the chat, so I'm going to answer those before moving to the next slide. Children under 6 will get summer PBT as well. They will get a different amount of money because it's an additional amount of money covering October through now. So it'll be a different amount of money based on that larger timeline. So it'll be more money for summer PBT for children under 6. Are they doing reconsideration for summer as well? We haven't learned anything about reconsideration for summer as well. I'm guessing there will be some sort of process kind of following the similar process as what they've been doing so far, but we'll definitely share that information as we get it of if there will be reconsideration for summer. Next slide. The next slide is just a link to all of the graphics and resources we've been sharing out, which you can find on Feeding Kentucky's website. We will be sure to update those too as we get in more information on summer PBT in the 1 through 6. So you can also find the numbers for calling to replace your card or how to contact DCBS on that website as well. So just wanted to share that as a resource. And I'll keep an eye on the chat to answer any other questions moving forward with PBT, but thank you so much. And I'll move on to the next speaker. And I think the topic is Medicaid.
Thanks, Jessica. Hi, I'm Priscilla Easterling, the Outreach Coordinator for Kentucky Voices for Health. And I'll be doing a healthcare update broadly, which will include Medicaid, but also Marketplace and ACA as well. Next slide, please. So just a couple of reminders. We all know that the public health emergency is still in effect until July 19th, We do anticipate and expect that it will be extended through October 19th. The Biden administration made a commitment to states at the beginning of the administration back in January that they would give states a 60-day notice before the end of the PHE. So that way states have some time to prep and they're not just all of a sudden cut off from everything. So just taking that into account, we did not get, states did not get a notice back in May that they're going to end it. So we can assume that it will definitely be extended through October, which lines up with what all of our national partners expect. And we do still anticipate it to extend through the end of the year, but yeah, 90 days at a time. So next, the Medicaid. Throughout the entire pandemic, the copays for Medicaid have been suspended, but now SB 55 is officially in effect. And so so that permanently prohibits all forms of cost sharing, including those copays for Medicaid and K-CHIP. So if you know of anyone who is paying any copays, if you're paying any copays for Medicaid or anything like that, please reach out and let us know because you're not supposed to be. And that's a problem. So if you know of anyone, definitely let us know. And then just a couple of others, the COVID-19 tests, yes, they should still be free. Balance billing is common. Definitely check out the KJC blog and fill out that form if you have any questions or if you know of anyone who is dealing with that. Now is an excellent time to go get vaccinated if you have not. As always, as it has been, it is completely free out of pocket. All you need is an ID and your insurance card if you have one. If you don't have insurance, don't worry about it. Then all you need is an ID. Either way, whether you have insurance or not, you will pay nothing out of pocket. Don't. And if you have any questions about what else you need to get vaccinated or any questions about where to find it or anything like that, definitely check out that vaccine appointment checklist. But school IDs, passports, employee badges, there are lots of different forms of ID. It does not just have to be a state issued like driver's license or something like that. So don't let that keep you from getting a vaccine. Next slide, please. Okay, so there are no big updates on prior authorization, but I did just want to remind everyone. So prior authorization is still suspended for all substance use disorder and behavioral health services, as well as all medication-assisted treatments for MAT products. And then it's still suspended for any services related to a COVID diagnosis. So it can prior authorization is still in effect for everything else, but behavioral health, substance use disorder, MAT, and COVID diagnosis. So next slide. Thank you. So just wanted to give you an update about the Hcbs waiver funding. So as part of the American Rescue Plan, it provided Kentucky with more than $96 million that can be used towards that enhanced federal match for Hcbs funding. So back in May, April, DMS sent surveys to both providers and participants to ask for their recommendations for the best use of these funds. And then Thrive Kentucky, as a coalition, we worked with some of our partners in the disability community to come up with the best list of recommendations from us, which I've linked here, but a couple of just the highlights. $12 million for expanded waiver slots, and then other funding for the PACE program, direct support, professional pay enhancement, and increasing broadband access for Kentuckians. The cabinet will submit their proposal of how they plan to use those funds, and that will be done by July 12th. So we hope next month we'll have a better idea and we can give you an update of how they plan to use those funds. So next slide, please, Kelly. So for PE, it is still available. That is the big thing. PE is still available for you. Kentuckians are currently allowed 2 PE periods within the calendar year, unless your income is above that 138%, or you're 65 or older or have some other form of insurance. You can still access those 2 PE periods throughout the year. You're entitled to 2. Right now, there's about 20 to 30,000 Kentuckians who are currently covered by PE. As we talked about last month, around 100,000 or so Kentuckians rolled off of their second PE period at the end of June. So now if you have not used those 2 PE periods, if you have used one, if you're not part of that group, you still can access it. It is still publicly available on the Cabinet's website. I've linked it here. But there is a big change that's going into effect that already went into effect at the beginning of July. Next slide. So beginning July 1, PE coverage will now only cover up to 60 days, which will be the month of the application and then the following month. So instead of that 3-month period that it had been covering prior to this, it's now only going up to 60 days. And right now it will not be automatically extended. So if you want to use a PE period, if you want to use that eligibility, you're definitely welcome to. Please do, definitely apply. But if you need that second PE period, instead of being automatically re-enrolled, you'll have to go through and apply again, which again is fine. But just wanted to let you guys know that. And as we know, PE's is being managed by UHC this year. So if you have any questions or any sort of follow-ups or anything like that, you can reach out to United, or you can reach out to us and ask some questions. So next slide. So the special enrollment period is still going on. I love this. It's been like a solid several months of having a special enrollment period, and that just never happens. So that's still going through August 15th. We're down to maybe 40-ish days, a little less than 40 days of the special enrollment period. So you're running out of time to sort of take advantage of this wonderful opportunity. 4 out of 5 enrollees can still find a plan for $10 or less after the tax credits. That's an incredible deal. There are increased marketplace subsidies because of the American Rescue Plan, so it makes it super affordable, and it's definitely worth going to check out. Next slide, please, Kelly. Okay, and so this is just a breakdown of some of the savings before the American Rescue Plan and after, to give you a better idea of what you're actually looking at. If you've never gone through the marketplace, if you're not sure, you've just heard friends or family say, oh, it's too affordable, I can't do that. It's too unaffordable, I can't do that. This will give you a better idea of what you'd be really looking at paying. And again, under the American Rescue Plan, it has saved so many people so much money. New marketplace enrollees have saved an average of 25% since the American Rescue Plan, and current enrollees have saved an average of 40%, which again, like that's a lot of money. And so thank you to the American Rescue Plan, because those increased subsidies are life-changing. That's extra money in your pocket every month. So if you haven't gone through the marketplace, it's worth just going to check it out and getting even just an estimate of what you'd be eligible for. So next slide, please, Kelly. Thank you. So as I mentioned, most of the American Rescue Plan provisions went into effect April 1st. And some of those are those increased ACA subsidies for the plans. And it removes the 400% federal poverty line cap for the for the tax credit eligibility. So there's a lot more people who are eligible to go through the marketplace and get a tax credit and get an increased tax credit. So again, it's a really good time to go check it out. Don't let a prior year's bad experience or hearing bad stories from other people or anything like that keep you from at least going to look and check it out, because things have changed. The American Rescue Plan really made a difference. And for example, people with income below 150% of the federal poverty line will get a $0 monthly premium plan. Like, that's free. That is 100% free for your monthly premium. So definitely check it out. It is an option. Next slide, please.
Hey, Priscilla, before we move on to this slide, there's an answer I'm not sure I can get in the chat about people who have employment or have coverage through an employer or the option of coverage. What is the income amount? If you have to pay over 9-point-something% of your income, you can shop on the marketplace, right?
It's 9.83%. So, and that's for and it's for employee only. So there's this other thing, this other problem called like a family glitch. The way that the marketplace determines whether your job-based insurance is affordable is for self only. So if just you on this plan, you're going to pay less than that. Even if adding your kids, your wife, your spouse, whoever, your partner, even if that would suddenly make it unaffordable, if that would make that over that 9.83%, that it doesn't count. It's what we call the family glitch, which is really stupid and I hate it. But we find different ways to try and get around it if we can. Yeah, you can always apply through the marketplace. If nothing else, you just put in all of your information and it will tell you whether or not you're eligible. Doing the application does not enroll you in coverage. It does not sign you up for anything. It does not like lock you into anything. You can always just do the application. It'll give you a full eligibility determination. You can shop around and look at the plans that are available in your area, and then you can decide whether or not it's going to be affordable for you or if that's something you want to do. But just doing the application is always a good idea, and it will give you a better idea of where you stand. Okay, so one of the really cool brand new provisions that went into effect at the beginning of July is this really great unemployment provision that again was passed through the American Rescue Plan. So any Kentuckians, any Americans, anyone who received at least 1 week of unemployment benefits during 2021 will have access to a silver benchmark plan at $0 monthly, which will give you the maximum cost sharing benefits regardless of any income changes later on in the year. So if you got a week of unemployment back in February, if you get a week of unemployment back in June, if you got a week of unemployment back in September, you would be eligible for this $0 monthly plan. This applies to your entire household. So if one person got unemployment, then the entire household's income will be looked at and counted as no more than 133% of that federal poverty line, which will make sure that you're eligible for that $0 plan and the maximum cost sharing reductions, which are those things that make the out-of-pocket costs much more affordable. So the cost sharing reductions lower your deductible, the co-pays and co-insurance and things like that. So it's a wonderful opportunity. It's a brand new opportunity, but it's only available for 2021. So you definitely want to make sure to take advantage of it if you can. And the state issued letters and is reaching out to UI recipients just to let them know about this opportunity and encourage them to check it out. So if you haven't, definitely do. If you already are enrolled in a plan and now that the UI benefit is in place, go back and update your application because it will change it and reflect that $0 premium. Okay, next slide, please. Okay, no big changes with Cobra or anything, but just wanted to remind you guys that this is an opportunity. Cobra Subsidies under Arpa, the American Rescue Plan will provide 100% of those Cobra premiums to premium subsidies to eligible employees from April 1st all the way through September 30th. So if you're enrolled in Cobra or you were interested in Cobra, definitely go back and talk to your employer, because that is an opportunity to not have to pay a monthly premium for your health insurance. And I am all for saving all the money possible all the time. So that again is in effect until September 30th. And if you have any questions about Cobra or this specific provision, I definitely linked a frequently asked question, but you can also reach out to me and we can talk. Next slide, please. Yay, okay. So after, I don't know, several months, 8 months, 9 months, something like that, we finally got a ruling and the case was dismissed. The Supreme Court found that the plaintiffs lacked standing, which is awesome. And now the ACA is here to stay again. This is wonderful news. And if you can go to the next slide, actually, we were able to save a ton of protections for everyone. The biggest ones that I love to mention every time, pre-existing conditions, people who aren't, even if you are not on the marketplace, one of the benefits of the ACA that definitely affects everyone is that you cannot be denied coverage for having a pre-existing condition. You know what is a pre-existing condition? COVID. So that is absolutely that is wonderful for us moving forward, because now that is something that we all get to take advantage of. Whether you're on the marketplace or not, the ACA has impacted you and has hopefully improved and helped you in some way. So we were able to save a whole ton of things, including making sure that people didn't lose their insurance, people didn't lose their Medicaid coverage, Medicaid expansion, and people can't be discriminated against for being older or being a woman or having lifetime caps or anything like that. So this is just wonderful news, and the ACA is here to stay. Yeah. So I will be in the chat if anyone has any questions, and otherwise I will pass this on to Dr. Schuster.
Sheila, you're muted. Sorry.
Oh, and I was just so eloquent too. I just wanted to say that I'm particularly glad that the ACA has been saved again, because one of the things it did was to require plans to cover behavioral health, which is mental health and substance use disorders, and to cover them at parity with physical health. So some of you are not old enough to know that we used to have insurance plans that had no coverage for a mental health condition or a substance use disorder condition, or if they did have coverage, they charged a higher copay or co-insurance, and they had limitations on the number of sessions you could have or the days in the hospital. So the ACA has done a great job of making that coverage available to all Americans. Next slide, please, Kelly. So again, I just want to remind you, because I think these are treacherous times. I think we're caught in this. Is the pandemic over? Well, no. You know, we know from the previous speakers that there are still lots of causes for anxiety and even depression. There still is a great deal of unknown, and we human beings do not deal well with long periods of unpredictability, and that's what we've been in this pandemic. So we know we're still seeing anxiety and depression. We're also seeing post-traumatic stress disorder with those who have experienced the greatest impacts. And I think we haven't even begun to hear from our frontline workers who were in the hospitals and in the trenches, and we're seeing people, and we're their last people to hold their hand as they passed away. We know that workers in nursing homes have seen tremendous decline in their residents and more deaths. So it still is out there. And I think we need to acknowledge it. We need to see that it's affecting both our mental and physical health. And that's true whether, no matter what age you are, whatever race or ethnicity, where you live, what your economic status is. We've seen increased alcohol and substance use disorders, domestic violence, and unfortunately, we're going to talk a little bit more about suicide. The increase in the rate of suicide has been mostly with our youth, ages 12 to 18 nationally, and particularly with females in that age group. So we know this is affecting our young people, and we need to be ready to respond to that. We need to, people are trying to figure out what the new normal is. We hear people saying, I can't wait to go back to the old days. Well, those old days are not probably going to exist. And I think that's a cause for anxiety as well. So, and those of us who have children in our family, I have one granddaughter who cannot yet be vaccinated. And so she, worries, we worry for her when she's in different situations. And I think people are kind of hard on themselves right now. Why don't I feel better? Because things are lifting, except it may not feel like it's lifting. So I really want to encourage you, if these things are bothering you, it's not unusual, it's not abnormal. But if they get to a point where you're having a hard time kind of sorting out your feelings, you feel like they're interfering with your ability to relate to other people, to function in the way that you would like to, please reach out to someone who can help you sort out those feelings and deal with these uncertainties in a healthy way. Next, please, Kelly. So we talk about self-care and care for others. And what I'd like to remind you is that, when you're on an airplane and you're traveling with maybe one of your children or grandchildren, and they say, if the oxygen mask drops down, put it on yourself first, and then put it on whoever is with you. The same thing. We cannot care for others if we're not doing good self-care. So I really want to encourage you to think about what you need to feel healthier and to feel like you're in better control of your emotions and how you're feeling about things. So we all do better if we're have opportunities to laugh, to relax, to enjoy a good joke. People are not getting enough sleep. I think when we're working remotely, the days kind of run into each other. The days and nights run into each other. We get out of that routine, so we need to be sure we get enough sleep. Exercise is great for you. Exercise is a natural antidepressant. Walking at a good pace, swimming, any of those things will release endorphins that will help your brain function and help you feel better. Set healthy boundaries. And sometimes, particularly with the divisiveness that we see now around COVID, around the vaccinations, if you're with people, whether they're family members or friends or friends of friends, and you know that they feel very differently than you do about some of these things, set a boundary and say you're just simply not going to talk about it. You're not going to debate the latest thing that was on some news station. You're not going to talk about whether the election was stolen or not, and some of those things, and set yourself some boundaries. Give yourself permission to say to the person on the phone or whatever, I can't participate in this discussion. We'll have to talk at another time about something different. And give yourself some grace. Be kind to yourself. I think we're awfully hard on ourselves. And as I said in my earlier slide, I think people are feeling like I ought to be feeling better. And so there's something wrong with me if I'm not. So I think we're being very tough on ourselves. And stay connected to loved ones. In fact, it's very healthy for you to look and see what you might do to help somebody else, to reach out, to get outside of your own feelings of maybe depression and anxiety and look to help somebody. Sending somebody a note, sending a text or an email to someone you've not been in touch with and bring some joy to them would be very helpful. Next, please, Kelly. So a lot of us, I'm a licensed psychologist, so this doesn't apply to me, but a lot of what we would say ordinary Kentuckians don't feel like they have anything they can offer in suicide prevention, but that is absolutely not true. There's a wonderful program that you can learn in an hour to an hour and a half. It's offered free in a lot of locations called QPR, Question, Persuade, Refer, and it would help you. It's a kind of first aid like CPR. You know, a lot of us learned CPR. We may never have had to use it, but we know what would happen if we're in a situation where somebody needed that. This would be true of QPR. This helps you be sensitive if someone is thinking about committing suicide. I've listed some locations here. There's a program going on right now in the Louisville area, particularly also the Counseling Center at Western Kentucky University is offering that program. Or you could contact our state agency, which is the Kentucky Department for Behavioral Health. And if you have a group of people in your community or at your church or synagogue or temple that are interested in this, they will arrange to come and do a training for you. Again, it's an hour to an hour and a half, I think it will help you feel like you have some role to play, and you actually do have a role to play in preventing a suicide. And then the final slide, please, Kelly. Just a reminder of places that you can go to get help. The 1-800-273-TALK not only connects you to a counselor, but it will connect you to a counselor that's in your local area, so they can hook you up with resources. There's also a text line. It's been a real godsend for adolescents and young adults who don't like to talk on the phone, but will text somebody. And then the Trevor Project is for those who are LGBTQ or are struggling with those issues, who also are feeling suicidal. Marcy Timmerman from Mental Health America of Kentucky very often is on these calls, and her organization also has help that you can access. I would also recommend, if somebody is struggling with their recovery from a substance use disorder, remind them about AA or NA, Alcoholics Anonymous or Narcotics Anonymous. All of those are being offered remotely at this point, and that really helps people to stay connected. So I guess my bottom line before I turn it over to Adrian is be sensitive to your own feelings and reach out to get help if that's what you need. Thanks. And we'll turn it over to Adrian.
Hi, everyone. It's good to be with you today. Adrian Bush with the Homeless and Housing Coalition of Kentucky. Next slide. Okay. For one final month, we believe the CDC's eviction order on non-payment, evictions for non-payment, is in effect. Late in June, 2-ish weeks ago, the CDC extended their order. They indicate this will be the final extension. And then the Supreme Court declined to hear a lawsuit. And so therefore it is still in effect for 1 month. So if you need to get covered or haven't gotten covered or know of someone, please pass this information along. Next slide. The other thing that happened was that the Biden administration committed to using a whole of government approach, so that it would no longer just be the CDC's purview, but all agencies with the stake in keeping people stably housed would be working to do so. Next slide. Okay, but in the meantime, even though we do have rental assistance available, the situation is still pretty dire. Over a quarter of all calls coming into Metro United Way 211 remain for housing and shelter. And of those, rent assistance remains at just under 70%. Those numbers are essentially unchanged from last month. Next slide. This map actually shows you where in Jefferson County most evictions, eventually where most evictions are being filed, but also where most of the calls for housing and shelter go through. And this just reminds us of the longstanding impacts of racism, redlining, segregation, and poverty concentration that we have all over the Commonwealth, but we're highlighting Jefferson County right now. Next slide. If you need rental assistance, here are some links. At Louisville, in Louisville, it's stopmyeviction.org. Lexington, it's a little bit longer. And then the rest of Kentucky, the other 118 counties, is teamky, hherf.ky.gov. Next slide. Okay. For people who are at risk of foreclosure because this pandemic has continued to go on, and we know that folks who are cost burdened, whether they are home renters or home owners, that it's actually your income level, and low income people tend to be paying a higher cost share of their income towards housing. The federal government continues to monitor this situation. The various federal agencies have extended the foreclosure moratorium through July 1st, forbearance through September 30th, and further action is expected. Thanks to the American Rescue Plan Act, Kentucky will have a homeowners assistance fund, which has not been in place. This is very similar to actions that were taken during the Great Recession. We will have at least $85 million to help people with mortgages who have experienced economic hardship. This program is not yet set up. You want to get notified when the program is set up, ready to take applications. Click that link when Kelly sends out the slides tomorrow. Next slide. Okay, and then at the federal level, we are still calling for universal housing choice vouchers, and we would encourage people to sign on to the Housed campaign today. A lot of the heartache and disruption over the last year could have been avoided if we considered housing a public good and funded it as an entitlement where it belongs. With that, I'll turn it back to Kelly and Emily to close us out.
Thank you, Adrienne. I'm always so impressed by how succinct you are with your slides. This has been so much good information today. I know we're going a couple of minutes over. I'm not going to cover these resources. They've been very, very slightly updated since June. So all of the resources, the links that we've talked about today are here. We'll be sending this out tomorrow with an evaluation. So please remember to let us know what you're interested in hearing in our upcoming calls. In August, we'll be having our next forum with the Cabinet for Health and Family Services. We do that every quarter. And we're always here to answer questions in between these webinars. So please reach out. And the last thing I'll say is thank you again to our sponsors. And thank you all for hanging in there with us and for joining today. And I hope everyone has a good afternoon. Bye.